here at Truehope, we engage with people on a daily basis who have been, locked into a medical diagnosis and a series of drugs for, sometimes 10, 20, 30 years. And they're looking for an alternative answer, looking for something different to relieve their symptoms, to make them feel better rather than just existing. And
I know somebody, so I'll give you an example. I know somebody that's been in a schizophrenia hospital for 30 years, and they're on 6 to 8 different medications. And I guess it just basically, these medications make them docile. It's just almost like become sheeple, just
the sedatives, those constant sedatives.
Sedative, right?
Yeah.
Have you had success of weaning somebody off these 8 medications, and how does that work?
It's an amazing question. Welcome to the Truehope Cast podcast, the official podcast of Truehope Canada. I'm your host, Simon Brazier, and in today's episode, we're diving deep into a topic that bridges nutrition, spinal health, and the holistic approach towards healing. Our guest is Dr. Edward Esposito, a dedicated chiropractor based in Miami, Florida, with nearly 3 decades of experience helping patients from college athletes to professional baseball players, helping them find lasting relief and elevating their performance. Dr. Esposito has made a name for himself by integrating advanced techniques like the trigenics myoneural method and dry needling into chiropractic care, while also weaving in the vital role of nutrition in musculoskeletal health. In this conversation, we are going to explore how chiropractic care optimizes athletic performance and recovery, innovative ways to manage chronic pain without surgery, and the powerful intersection of nutrition and spinal health, and also real life stories of patient transformation. Truehope Canada is committed to promoting brain and body health through nutritional, natural means. We have a massive value that aligns perfectly with today's conversation. For more information about us, please visit truehopecanada.com. Get ready to be inspired by a unique perspective on holistic wellness. Let's get into it. Enjoy the show. All right. Okay. Hi, Dr. Edward. Welcome to Truehope Cast. Thank you so much for being with us today. How are you and what is going well?
Very good. What's going well?
Yeah.
Always learning, always helping people. It's amazing how confused people are when it comes to health sometimes. So it's always good to be point them in the right direction.
Yeah, it's quite remarkable that we need all of these amazing practitioners and from different areas and walks of life to kind of remain healthy and remember to stay healthy and to do all of these things that we need to do to contribute towards our health. And I just imagine, we didn't have all of this 1,000 years ago and people seem to be relatively healthy. So it's like we're trying to re-educate ourselves to get back on track.
Yeah, less toxins, less pollution, less preservatives, less mortgages. Yeah.
Yeah.
Sounds like a fun time.
Yeah, I guess we're just trying to deal with the man-made issues of the world, I guess, in a new way, in a new world, new wild world.
Yep.
Well, we're going to be discussing integrating nutrition and chiropractic for holistic wellness today. But before we jump into that topic, would you mind maybe just giving us a little bit of a background about who you are and what it is that you do?
Okay. Well, I'm a chiropractor for 29 years. Became a chiropractor just by chance. I was 10 years old when my mother had her first bout with almost going into a diabetic coma. She had undiagnosed diabetes. She was about to pass out, and she said, "Go get me orange juice." And we were in the Staten Island Mall, and really watched her really decline pretty quickly. About 8 to 9 eye surgeries, was on dialysis for 7 years. And so from the time I was 10 till 27 when she passed, which is a very quick time. Unfortunately, medicine is better now. It had a profound effect on me. And when I was about 18, I was constantly having headaches, and somebody said, "Go to a chiropractor." And I said, "They're a bunch of quacks." And but I was taking Advil twice a day for 4 years. And I always had this dull sensation here, and went to the chiropractor, and within like a week, they were gone. Never really came back. So I was like, I want to be a chiropractor. I want to help people. And through my journey, I had cancer 15 years ago, non-Hodgkin's lymphoma. I helped treat it naturally through different types of vitamins, through infrared saunas, through hot yoga, through colonics, through protein enzymes on empty stomach. And I've also been a chiropractor for a professional team. One of my sons is a professional baseball player. The other two played college baseball. So I kind of go all over the place.
Amazing. I'd love it if you could just take me back in your journey a little bit. I wonder if you could maybe think back to the time, because I think what you said about you got recommended to go to see a chiropractor, and you just associated that with quacks. But at the time, you're actually taking, you know, Advil twice a day to deal with the pain.
Yeah.
Where do you think that perception came from, that the chiropractic was nonsense and a little bit hoo-hoo, but taking, you know, pharmaceutical drugs every single day was fine?
I mean, we know exactly who that came from now. So in the 80s, there was a class action lawsuit. 3 chiropractors got together and they proved in court that the American Medical Association colluded, hired, no different than actually happens in the stock market now, but that's a whole nother subject.
Yeah.
But they basically colluded to defamate chiropractors and paint us as quacks. And they did a great job. I mean, it stuck for many, many years. And I think it went back to like the 60s and 70s when they went through the court case. It was Wilkes versus the AMA. And you can look that up. It's a fact. So it was a slander piece on chiropractors and people bought it. And then when you couple the fact that every third commercial on TV has to do with with pharmaceuticals, then you look at our country. It's probably the wealthiest country. We have the best technology, the best AI, the best this, the best that. But yet we rank 69th in overall health. So there's other countries far less superior to us, and they don't have the type of problems that we have. So we are dependent on drugs for sure. And the more we're dependent on drugs, it's a repeat client. So that's really where it comes from, you know. And I know for me, I get very, very frustrated if a patient always comes in with the same pattern. It drives me crazy. So are you always holding the baby on this side? Are you always doing this on this side? Is your monitor look like this? So we assess you, and then we figure out, well, what can you do so you're not dependent on me? Because people go, oh, once you got to go to a chiropractor, you have to go the rest of your life. Not really. You don't have to go as frequently. I get you from here to here, and then I maintain you, but you won't need me every day like you would need a medication every day. So it's a great question, Simon, and it was an extremely long answer.
Yeah, no, that was great. And yeah, I mean, just being able to ask those questions about, like how are you sitting, how are you holding your baby, what screens you're looking at, you know, it's a fully well-rounded healthcare approach that, you know, you're looking at occupational therapy kind of thrown in there as well. And it's very difficult to have like those long-winded, in-depth, necessary conversations in like a 7-minute medical appointment with your doctor. So yeah, it's wonderful that we actually have practitioners like yourself that, you know, have unfortunately had the experience like you have with your mother and what she went through in your own circumstances as well. But it always seems to me, we've had so many great people on the show who have gone through those circumstances and have come out the other end with so much experience, so much knowledge, and so much motivation to be able to support people to not go through similar things in their lives.
Yeah, we try, you know.
Yeah. And the wildness of the very deliberate attack on everything other than, you know, petrochemical pharmaceutical medicine is quite remarkable. And chiropractic seems to be one of the ones that survived and has obviously had to fight its way to be able to do that. If you talk about like homeopathy or maybe like herbal medicine these days or acupuncture, depending on where you are in the world, it's going to get that same kind of like rolled-eyed look, which is quite remarkable considering that, you know, herbal medicine, so pharmaceutical medicine all comes from herbal medicine, and some of these TCM Ayurvedic practices are thousands of years old with remarkable amounts of evidence towards them. But yeah, we have been very deliberately programmed, I guess, to believe that anything other than, like a doctor in a white coat and a prescription pad is the only way to go.
People don't realize how little nutrition medical doctors take when they're in medical school. So we take a lot of anatomy and physiology and kinesiology and public health, and the medical doctors barely do anything on nutrition, which is interesting. I mean, you are what you eat, right? And there are chemical imbalances. I mean, I haven't really looked into what you're doing with Truehope, which really excites me. But people get allergies when they eat certain foods, and your brain's an organ, just like the liver is, and the digestive system. And so if there's chemical imbalances through nutrition and you're lacking certain nutrients, I can see the benefit of what Truehope is doing to help people with depression and mental illnesses, because an allergy could affect the brain.
For sure. And everything within the body is so beautifully connected, from every cell to every organ system. And if you're experiencing chronic nutrient deficiency, like most people are, because our soil is so depleted, good quality organic food so expensive, the junk food's super cheap to buy, it's very, very easy to get into this significant state of lack, and the body can only deal with that circumstance for such a long period of time before it gives out, and one of these systems is going to have an issue. And then what do? We go to a doctor, and then we usually go and see a specialist that kind of focuses in on that one area, rather than having this like holistic viewpoint of like the whole body is this system. And it really doesn't serve those individuals who, at the end of the day, like, they don't want to feel terrible, they don't want to be sick, they don't want to be struggling with their lives. They want to be happy and healthy. Yeah, it's wild stuff. But I want to I'd love to start talking about, because I know you've got a range of patients, from like professional athletes that you've mentioned, and from those who are suffering from chronic pain. So I wanted to ask you about what is it about chiropractic care that makes it so effective for performance enhancement as well as recovery?
One of the first teams, so I'm in practice 29 years, and I've seen it all. It seems like in the last 5 years, things are really picking up with physical medicine as far as the results we can achieve, where things that I couldn't fix 5 years ago, we can fix now. It's mind blowing. And I love to go to seminars at least 2 to 3 times a year, even though I only have to go to one a year. I try to do more. I want to do more. It's unbelievable. But what's interesting is that do you know American football at all?
I am familiar. I live in Canada, so I do get that type of exposure to the NFL. Yeah.
So I think it was in the late 80s. It's a tremendous team. A lot of Hall of Famers. The San Francisco 49ers. Joe Montana, Ronnie Lott. An incredible, I think they won 4 Super Bowls during that era, like the late 80s. But what was interesting is that they were one of the first teams to adopt a team chiropractor. And they were a great team. There's no doubt. But you're only as good as if the players are on the field. If you're injured, you're not going to be as good. You could look at the Detroit Lions of last year. They were probably the best team. They had so many injuries that they couldn't even compete in the playoffs. So when you look at getting people more structurally sound and more efficient, they could take those hits better, right? Something that's crooked that gets a shock is going to crumple, or something that's in better alignment and tuned is not. And so the Niners themselves attributed their success in the late 80s due to the fact that they kept their players on the field. But you get a patient with a crooked hip. Now that hamstring's pulling different. Now that calf is pulling different. Yeah. Now that 4.640 is now a 4.840, and they're running slower, and they're not as explosive off the ball. And these are things that I see. I see an NFL lineman. He's one of the best defensive linemen in professional football. Can't say his name, but he's won a few Super Bowls. But he'll get into his stance and the way he pushes off. And then when he comes in, I could see, if things were not aligned right, he's not going to have that drive that he's supposed to have. And you do see like some people, especially my tennis players, I could always tell if they're a righty or lefty. If they're not using their hips properly, you're going to feel a lot of tightness in their mid thoracic area because they're not properly engaging their hip or their core. So all these things just make a huge difference. And then we'll give them like counterbalancing exercises. Hey, make sure you're doing some lefty to even it out. If you're a lefty pitcher, do some drills righty to balance it out. That's something that I learned from Pete Rose Jr. Pete Rose Jr. I got to meet when I was selling a nutritional product, a protein powder. And Pete Rose, his dad was one of the best hitters of baseball ever. But he would really try to make all his players switch hitters because if you're always stressing on one side, it's going to wear and tear too much. But the short of it is, yeah, it makes a huge difference in performance. And if you could fine tune somebody, I mean, almost you look at all these specials now on quarterbacks on Netflix. A lot of these guys are going to chiropractors the Friday before that Sunday game because they know that they're just going to be more fine tuned.
That's cool. Can you give me an example of like what you couldn't fix like 5 years ago that you can now? Like, is
neuropathy is one. Neuropathy is one. I wish. Let me see if I have a picture of it. Sometimes we go educate some of the doctors and stuff. So this is a machine that's amazing. It's I don't know if you can see that.
Yeah, I can put it on. Yeah, I can see that.
Okay, so it looks like a traditional TENS unit that you buy off Amazon for $30.
Yeah.
But it's called the Rebuilder, and it has a proprietary technology where it activates what's called C fibers, and it activates dormant sensory nerves. So people that about 40 to 50% of the population, maybe 30, get neuropathy. It's idiopathic. They don't know where it comes from. You're 70 years old, and all of a sudden, from your elbow down to your hands or from your knee down to your feet, you can't feel anything. You start losing sensations in your feet. And that machine, if they use it at home, 30 minutes twice a day, coupled, that helps the nerve fibers activate dormant nerve cells through the C fiber, and they get better. And then we have a red light therapy that they use at home 30 minutes, and that helps with new capillary angiogenesis and new blood formation.
Amazing.
And a lot of these people almost have like 100% gone like in a month or two, where the alternative is they take an anti-seizure medication for the rest of their life, which pharmaceutical company loves.
Yeah. So
that's one of the things.
That's really cool.
The other thing, it's pretty cool. The other thing is this stem cell cream. I got this from a very famous NFL quarterback, got me turned on to it. And a lot of these people now are flying down to Costa Rica, Panama, because they take the placental and umbilical cells from healthy C-section babies, and then they process it. And what the stem cells do, and this is a cream, so it doesn't have to be injected, because your skin is the largest absorbing. Your skin is the largest absorbing and eliminating organ in your body. Mm-hmm. So they use lipid nanoparticles. And so you could have people that have almost bone on bone in their knee. It helps regrow the cartilage in the knee. Stem cells adapt to where it's abnormally firing. Is it the cartilage that's not firing right, the ligaments, the tendons, and it basically regrows it in like 3 to 6 months. The patients feel the benefit. We see differences on x-rays because when there's ligament damage and you bend your head forward, you'll see a slippage of the bone because the ligaments are holding that bone together. And then we'll see like a month or two, I do that same thing and the bones are moving together. There's no break. So it could strengthen ligaments. It could help rebuild cartilage, specifically in the knee and the shoulder. My girlfriend's father is a 30-year fireboat captain in Government Cut here in Miami. That's where all the cruise ships come out of Miami. Very, very choppy water. Mm-hmm. Her dad would take this little fireboat captain and he'd come up to the cruise ships and very rocky water. He's got all types of tears in his shoulder, labrum tears, ligament instability. Within a week of using this cream, he's like, I can't believe how I feel. I'm 80% better. Otherwise, he'd be getting nonstop steroid injections, which are degenerative for the rest of his life. That's another thing. Then the other thing that's amazing is shockwave. Shockwave's unbelievable. 3 years ago, I had a massive strain in my forearm, and I was like, man, this is going to take a while to fix. I got Shockwave. It's based on German technology. It uses sound waves to break up. They use sound waves to break up kidney stones. That's called a focal. We use radial in chiropractic, which means it goes to the air and it goes like that. So it affect the muscle, the ligament, the tendon. So if I want to penetrate here, it will get this whole area, but you feel like the muscles just relax. So what would take like a hamstring pull? So I'll give you the common things that I see now. Everybody's playing pickle and paddle. So people call it padel. Some people call it paddle. I say, is it paddle if you have a ham sandwich and padel if you have caviar? I don't know what the difference is, but padel sounds more fancy. Okay. So everybody's playing pickle and paddle. They're all straining their forearm flexors and extensors. They're all pulling their calves. They're all pulling their hamstrings. They're all getting plantar fasciitis in their foot. The shockwave treatment in 3 or 4 treatments, bingo, it's gone. Now, we also give them exercises to prevent it. We also make sure their hips are in proper alignment. It's usually what usually happens is you have a left high hip, putting more weight in that right side. Oh my God, I'm so smart. Guess what usually gets the plantar fasciitis? The right side, because it's getting abnormally loaded. So these are all the things that we see.
Yeah. That's really cool. And correct me if I'm wrong, but I think a lot of these technologies, there used to be huge, big, expensive machines that not everyone had access to, but now they seem to have really like nailed in the technology to make them, like a lot of them handheld. So a lot more clinics can have them, and even consumers themselves can have them at home to treat themselves.
First got into practice 29 years ago, had $120,000 in student loans. I go out and I buy $100,000 C-arm, which is like, ever see the movie Total Recall?
Of course.
When he runs through and you can see his spine, you can see the spine in motion. So I worked with that for a couple of years, and I got to learn a lot about my technique, and that was a lot of fun. And then when they first came out with red light therapy, I bought a $15,000 red light therapy machine. Now they're like $2, $3, $4 grand, So yeah.
Who was your financial advisor when you came out of school?
Everything came down in price, man.
Yeah, it's interesting. The technology is quite remarkable.
It's exploding.
And,
It's exploding.
Do you think you can do you think people can do too much and be reliant on all of these instruments?
100%.
Or do you think there's you need to be working with the right practitioner to give you the right thing to do? Because I know people that, they'll watch an Instagram ad and they'll buy this red light thing, and then they'll buy this ultraviolet thing. They'll buy all these things, and it's a bit much.
You could overdo it. You could overdo it. Again, is it repetitive in nature? Is there things that you could do to prevent it? Can you take fish oils to decrease your inflammation naturally and stuff like that?
Yeah, it's obviously very, very helpful to be able to use, sound waves or light to be able to engage with your skin to, heal you kind of from an external way in. But then, if you're able to provide your body with, for example, like the correct available nutrients, so your body's able to galvanize those and use those on a consistent basis to be able to heal you kind of from the inside. I feel if you're working responsibly with both of those things, you can do remarkable things for your recovery, for your performance, and I guess for your general health.
Yep.
Yeah.
Sometimes we get the patients playing pickle and paddle. They grip the racket too tight. That's another issue too that we see. But listen, this thing's amazing, the stem cell, because I have patients that were professional tennis players. They're now 60. They have arthritic hands. They have arthritic elbows, and they've done PRP injections. They've actually done stem cell injections, and I find that this thing works better.
Interesting. I'm totally going to look into that for my dad, because he could certainly benefit from something like that. But I know you've also, like, on your website, I've noticed you've mentioned advanced techniques like trigenics, myoneural method, and dry needling. Can you tell me a little bit about that and how that doesn't sound like a traditional chiropractic care option. So how has that come into the world of chiropractics?
Yeah, so active release therapy really started like the soft tissue movement, because we know that when there's scar tissue or there's tight muscles, it's going to be hard to adjust something. So a lot of times you could do these soft tissue releases and lengthen the tissue. And when you go ahead and adjust them, it's a lot easier, or they'll hold their adjustment better. So I got introduced to trigenics myoneural technique. I forget how. Oh, because my son's a pitcher and he was having some issues with his shoulder, so we had him get checked out by a practitioner. I said, "Man, that really works." So I got trained in it, and when I got trained in it, the first guy we worked on, he was a veteran, and he jumped off a cliff or something and like broke like 10 bones in his body. He had all this type of scar tissue. He had numbness in his hands and his feet. So we did all this soft tissue release. And by the end of it, we worked on the guy for like an hour. Mm-hmm. And by the time we were done, it basically untrapped the nerve, and all that sensations went away. And it also focuses on the rehab as well and what muscles to strengthen as well. So that's a phenomenal technique, trigenics.
And sorry, is trigenics, is that like you'd be having your hands on somebody? That's like a manual technique.
It's a manual technique, very much so. Yeah.
Interesting.
Yeah. So I mean, you could literally, the 600 muscles in the body, you could release any muscle in the body. It's really just a contract, relax technique. It's like a lengthening, but you're also hitting the muscle fiber in a certain way to release the muscle. It feels great, especially when you do it on the traps. Like people here, everybody's tight here, and you release that, it's like, oh my God. And then when you go to adjust them chiropractically, it's you don't have to use a lot of force.
Interesting. So that would be something you would do maybe pre-adjustment.
And then the people love the dry needling. I'm trained in it. I don't use it that much anymore, to be honest, because I feel like the shockwave does what I need to do. The shockwave sends those waves in there, those sound waves, and the muscle just, I tell all my Spanish patients, it makes it like a Milanese, like flattens it out.
Okay.
You get like a tight muscle and it just.
Yeah. So. Well, that's great. Now, some of these options just seem to be super beneficial. And yeah, as you said, like the technology and the techniques and the training becoming more available to different people. It's just, if we can relieve people's aches and pains and get them on the right path, it's, it's wonderful. We, here at Truehope, we engage with people on a daily basis who have been, locked into a medical diagnosis and a series of drugs for, sometimes 10, 20, 30 years. And they're looking for an alternative answer, looking for something different to relieve their symptoms, to make them feel better rather than just existing. And
I know somebody, so I'll give you an example. I know somebody that's been in a schizophrenia hospital for 30 years, and they're on 6 to 8 different medications. And I guess it just basically, these medications make them docile. It's just almost like become sheeple, just
the sedatives, those constant sedatives.
Sedative, right?
Yeah.
Have you had success of weaning somebody off these 8 medications, and how does that work?
It's an amazing question, and the product was originally designed for the founder's children who were suffering with bipolar disorder with rapid cycling.
Yeah. And
that was what the original research was done on. And just the fact that you mentioned 6 to 8 medications, and I've got to mention these individual medications are certainly researched and studied to be proven to be safe for the market. To what extent, I don't know, but there's no way that they research these drugs together, let alone 6 to 8 of them. They exactly. They don't research them together, and they don't know the side effects long term or even short term, what these medications will do to each other. And a lot of the time, 20 to 50% of the medications someone might be on are just there to be dealing with the side effects of the other medications that they started on. So it can end up being a bit of a cocktail, a bit of a mess that's quite typical with bipolar disorder. Someone would usually be put on something like lithium to begin with, but it wouldn't be uncommon after, 10, 20 years of trying to help deal with somebody's symptoms that they might be on 5+ different medications. But what we have here at Truehope is a micronutrient support team. So anybody who is so it even says it on the label here, like if you're taking a psychotropic medication and you're looking to come off that and be reliant on basically food and nutrients in bioavailable forms, then you need to be working with them, having conversations with our micronutrient support team so they can help people wean off these drugs properly, because there is a cross titration that will happen if you start taking these products with certain psychotropic medications. And our team is so well versed in these medications. You know, we've got nearly 30 years of experience now working with people, and we've had this support options from day one, because it is complex and it is very, not everybody gets the support from their psychiatrist or their doctor to come off their medications, because obviously, doctors aren't trained in nutrition. They're trained in diagnoses, and they're trained in prescriptions. So coming off that path is it's not something they're trained in. I guess it would be something they'd be scared to work with. But there are certainly psychiatrists and doctors out there who have, I want to say, seen the light and have seen people want to take an alternative route and have been really successful. That we've had Michelle Rettinger on the show a couple of times. She wrote an amazing book about her transformation using this product to basically relieve herself of her bipolar disorder that she doesn't have anymore, using micronutrients. And she basically did everything wrong. She didn't call micronutrient support. She came off of all of her meds cold turkey, and she wrote a whole book about how it's not a good idea to do that. And in regards to schizophrenia, we do have, I think there's one or maybe even two papers that have shown using micronutrients to help provide the brain, primarily with the minerals. Most minerals on the market are chelated, broken down for 4 hours, and then put in the capsules and then put out there. But we break down our minerals for 4 days, so they're able to cross the blood-brain barrier and actually nutrate the brain. And that is a primary reason why the initial research showed such amazing results with bipolar disorder. But we see across the board with our research, 35 peer-reviewed medical journals, ADHD, depression, anxiety, schizophrenia, bipolar disorder, stress, trauma, you name it. This product has been able to support people just to be able to get nutrition into their brain, to deal with the fact that they've got to get toxins out of their brain, and they've got to get nutrition in to help allow them to create good quality brain cells and allow that transmission to happen. So that's, again, I've just given you a long-winded answer to your question, which is such a good one, but we see remarkable success. And it's such a shame that we up here in Canada, it's very, very challenging to get natural health products on the market. It's very, very challenging. In America, they're classified as food. It's a lot easier. There's a lot less red tape. And if it wasn't for deliberate actions by Health Canada, then I'd love to think that anybody who went in to see their doctor and who is struggling with anxiety or depression or a TBI or a concussion, something like that, they'd be put on this product first to help get their brain the right nutrition it needs to deal with that actual physical stress, before jumping onto a harsh pharmaceutical medication that technically they wouldn't ever really come off, because they'd be reliant on that forever.
So, by the way, I did get your product.
You did. Great. I sent you one. I sent Dr. Edward and Power Plus to the post,
and I have taken it a few times.
Oh, okay.
Now, what if I'm depending on the day, I'm usually not, bipolar. I'm joking. Like a somewhat normal person like myself. I don't think anybody's normal, but a person that doesn't have mental health challenges. Do I take it?
It's a very, very good question. And the answer is absolutely yes. I mean, I don't have any, personally, I don't have any clinical diagnosis of anything, but, I've got 2 young kids. I work a lot. I like to have a lot of energy to hike and play golf and play soccer and all these things. So I need to supplement my diet, because there's no way I can get the necessary nutrition for my energetic requirements from the terrible food that we have and the terrible soil. So I take 4 Power Plus twice a day, along with our free aminos product, which is a free form amino acid. And if I don't take it and I forget to take it, I feel it very, very quickly. I think my body's very much got used to having that extra nutrition come in, and I just get a little bit more, my patience disappears a little bit more. I get a little bit more angry sometimes in those situations where, my patience, I guess, is being tested. So for me, like it's performance optimal just for my everyday dealings. And that just goes to show that the evidence that we do have, that these 35 peer-reviewed medical journals, it's going across this wild spectrum of psychological disorders. You've got you've got schizophrenia and psychoses and bipolar on one end, and then you've got like stress and traumas, anxiety and depressions on the other, and everything in between. Just going to show that this product's just getting into the body and fueling the brain and body with the right nutrition it needs to function optimally. And everyone can benefit from that, whether you do have a psychological disorder, which I think in many cases, many psychiatrists we've had on the show would argue that a lot of these significant psychological disorders is just chronic nutrient deficiency. And a lot of people who do have a genetic disposition to requiring more of certain vitamins and nutrients and minerals, they're the ones that exhibit these wild symptoms that end up obviously getting classified in these areas of bipolar disorder and schizophrenia, etc. But across the board, most people are nutrient deficient and would absolutely benefit from this product. And as I said before, if it wasn't for government entities, especially in this country, doing their very best to not have this as an option, because this is a direct competitor to antidepressants. We've got evidence for that as well, that it's 3 to 5 times more effective than antidepressants. And in Health Canada, for example, like 2/3 of their money come from pharmaceutical companies, and you can see in their literature that they consider them clients of theirs. So that wouldn't be good for business if people are just taking a natural product that is cheap and effective. So yeah, it's complex, especially up here in Canada, but no, it's just the reason why we do this every day here at Truehope is just we don't want people to go through the tragedy and trauma that our founder's family went through, and that's kind of where this Truehope piece comes from. And as the work you're doing and the education that you continue to do and the motivation, the passion you have for your work, you want to see people thrive and get rid of their pains and be able to go out there and do all the amazing things that God has given us in this world.
So hold that thought. I got a few things. I want to get this bottle here. Hold on.
Okay, go for it.
All right. So you take 4 of these twice a day with or without food?
My gut seems to deal with it absolutely fine with or without food. Okay. So depending on my circumstances, I don't usually eat my first meal until like 10 or 11 o'clock. So I usually kick off with like a protein shake, and I'll take my supplements at the same time. And I will take them before 4 o'clock because they can affect sleep. They can keep you up. They are, it's an energizing product for sure. But what we could do is, we can come back in a month once you've taken the product for a month, see how you're doing, see if you've noticed any benefit.
Should I do 4 twice a day, or should I start less?
Maybe start with 3 twice a day, and then bump that up. See how you're feeling. Obviously, it's something new that's going to be coming into your body. See if your guts feeling fine with it. If you don't feel any like nausea or anything, you shouldn't feel anything like that. But then bump up to 4 twice a day, and that bottle will be gone in no time, and that nutrition will be straight in there. Yeah, some of the more recent research with concussions and TBI is so good, because obviously because the trauma that somebody's physically getting, from, let's just say, we talked about American football, and we obviously know about the concussions within that with the movies and all of the publicity that's got. But what is there like right now in like the medical literature to be able to give somebody to actually get nutrition into their brain to deal with the trauma within that system? And at the end of the day, it's broken down cells that have that are wrapped around in toxins and things that need to get out.
I'm looking at this stuff. So L-glutamine is great for muscle recovery. It looks like you have a lot of things like chromium. So does it have an effect on blood sugar? A positive effect on blood sugar?
It certainly does. I mean, we actually have a inositol in there as well, and it's incredible blood sugar
Blood
balance.
sugar.
And we actually have all of the product. So we just have 6 products in the Canadian division here at Truehope Canada, and every single product, starting with Empower Plus, we bought out a new product to complement each other. We saw kind of gaps in the market where people either there wasn't a product out there to support people with this, or there was, and it just wasn't up to standard. So that's kind of where we would introduce a new product.
So when I first got into practice 29 years ago, I used to do slides and PowerPoints and lectures. And one of the slides that we had was a picture of 1 head of lettuce and 20 heads of lettuce. And we would, what's the word I'm looking for? We would illustrate the fact that what we're eating now, the soil's been so over-tilled that there's not as much, it's nutrient deficient. Our foods are nutrient deficient.
You got it.
It kind of falls in line with what you're talking about. So you'd have to eat 20 heads of lettuce. This is now 29 years ago, by the way.
Yeah, it's going to be more now.
Yeah. I mean, I don't know. Who knows what Monsanto, what Bill Gates are doing? I don't know. But I've been taking supplements forever, right?
Yeah, it's a really good point. I mean, I went to nutrition school 10 years ago, and I had this egotistical idea that, oh no, I can just get everything from food. I don't need to supplement. I'm super young, I'm super healthy. And very quickly I learned that, it's our soil and it's our food, and it's this
nutrient deficient
history we have of mono agriculture that everyone has to be supplementing. And what sucks is that up here in Canada, that they make it so expensive. Like, if you've got to be in like literally the top 1% to be able to supplement yourself properly, because the red tape that keeps coming into manufacturers, it's really
that way here. It's the haves and have-nots. We have a whole department in our South Beach office. It's regenerative medicine, $3,000, $10,000 membership. It's within the practice. I don't own it, but it's for the people that have means.
Yeah, it's challenging, and it's those people that are struggling to make ends meet, that have the significant stresses, that have the significant anxieties, that need this product more than most. And we do absolutely everything we possibly can here at Truehope to bring the price down as much as we can. But like Health Canada, for example, with their self-care framework, that's a whole topic. They're doing their very best to make it challenging to get products out there. Site licenses, product licenses, making it more and more expensive for the manufacturers, and then we have to put our prices up, otherwise we go out of business. So it's super challenging, but yeah, we're doing everything we possibly can. And we get, I'm lucky here at Truehope that I get to see all the social media. I get to see our website interactions where people are like, thanking God that they actually were able to find us, because we're not just people's true hope. We're like their last hope in many instances, and it's kind of what keeps us going for sure.
So do you work with the patients? I mean, again, like if somebody's on 6 or 8 medications, where does this person start?
Yeah, another great question. And I get that probably 4 or 5 times a week. I get that message through our website saying, I'm on this, and this. Like, where do I begin? Because I can only imagine if I was on 6 medications and I've had this history of going to the doctor and these symptoms for 10, 20, 30 years. And then I find this hope, I find this true hope, this alternative option. What a scary place that would be for somebody.
I'm taking this now, by the way. Go ahead. Awesome. I'm all excited now. Go ahead.
There you go. Get it in you. That's great. So yeah, we get this question very, very frequently, and I immediately direct people to this micronutrient support team, and I'll put a link in the description of this show, because I'm sure a lot of people will be interested to learn more about that. But they're so well versed in regards to the medications that are being prescribed for depression.
So people can consult your people online to get.
Yeah, precisely. So you can call up, you can have a conversation with them, and then we have a monthly payment program that you would be involved in, that you basically could call up and get consulted with as much as you need. That's to cool. get you to a place where you are just being reliant on Empower Plus, and obviously we have conversations about the other things that are very, very important when it comes to your mental health, whether that be like exercise and the food that you are consuming, as well as the supplements. These are all very, very important topics. We can go into alcohol consumption and marijuana consumption, because all of these things have a negative interaction with these products and your ability to absorb nutrients. So it's a very full, well-rounded approach, just like, you know, you were talking about within your practice, that you've got to be talking about people's occupation and what they're doing at home is very, very important when it comes to how you can treat them and how they can treat themselves.
Yeah, that's great.
I would love to ask you about chronic pain. It's such a big issue for a lot of people. What are some of the misconceptions that you often see about how to manage it, and how do you address them in your practice when it comes to chronic pain?
You know, it's interesting. Say about 15 years ago, there was a big push with fibromyalgia and chronic pain.
I remember that.
It was such a big thing.
Can you explain quickly what that is, fibromyalgia, to people who don't know?
It's just a chronic pain syndrome. Oh, hold on. Okay. It's just a chronic pain syndrome, chronic inflammation in the joints. Could be chemical, one of the things that could happen is if you don't properly digest your food, what could happen is proteins could travel into the joint sites and create inflammation. So one of the things you want to do is make sure your gut, like you're saying, gut absorption. You could do digestive enzymes like amylase, lipase to help digest the food. You could use things like marshmallow root and aloe vera to help the stomach wall and the lining. So I think what happens with some of these people with fibromyalgia is a lot of them have digestive issues. It creates a chemical reaction inside the joints. For whatever reason, in the last 10 years, you don't really hear about this.
Interesting.
Right? You noticed that?
Yeah, I have. I remember exactly the kind of point you're talking about.
Thing, like 15 years ago. I don't know if more people are taking fish oil, which helps with chronic inflammation and pain. I don't know.
There's certainly been a massive influx of prebiotics, probiotics, gut integrity, gut health in the last 10, 15 years. That's been huge. You can go buy a probiotic drink at the dollar store these days.
I don't see fibromyalgia patients like that anymore. When it comes to chronic pain, what I do see that's interesting is I have a woman right now. She's 68 years old. She could barely walk. She's almost bone on bone in her right knee. When I examine her, her left hip is higher, so it's putting more weight on the right side. Her spine is shifted to the right, so she's going to be putting more weight down that side of the body. So we have to fix both of those things. We have a table that can pivot and maneuver, and I could mold your spine like clay to reposition it. But she'll have chronic pain if we don't fix that structural imbalance, hitting that right knee, that right hip, that right foot. So now what we're doing with her, not necessarily nutritionally, although almost anybody could benefit, it sounds like, from this product, from fish oils, from good digestive stuff like probiotics. I have all that type of stuff. Is now we could use the red light therapy on her knee to help decrease the swelling. We could use the stem cell cream to help regrow that cartilage and fortify those ligaments and tendons. So I'm seeing more repetitive micro trauma than I am, say, fibromyalgia now, for whatever reason. It could be text neck. Another thing, people are constantly looking down. So even I'm looking down right now. So I tell them, raise your monitor up. So you're kind of looking up a little bit, not down all day, So that's the kind of chronic pain that I'm seeing now, is either structural and chiropractic, or it's postural. Not so much the fibromyalgia, which is interesting.
Yeah, no, that is interesting. And the chronic pain piece, the chronic nutrient deficiency piece, for long periods of time, people get into these positions, and it can be challenging as a practitioner to help people find like a long-term solution, because people are just like, we're just used to these quick fixes, right?
Yeah.
And for a lot of people, that chronic pain, you know, the patient you're talking about, 68 years of age, you know, she's had 68 years alive. It's not like that chronic pain is just like, you know, turned up one day. It's obviously accumulated over years and years and years. And the same thing with like chronic nutrient deficiency, and then boom, like one part of somebody's body can't sustain that environment anymore, and then, you know, they have this pain, they have this discomfort, they have this symptomology, and it can be a challenge, I think. Yeah, how do you deal with that challenge when you've got somebody who's coming with a long-term issue and they're looking for a very quick fix? And, you know, how do you explain that to people, because it can be challenging?
It's funny, in the Spanish neighborhoods that I work in, I don't really speak Spanish, but some of my patients call me manos de Dios, the hands of God. Right? They like my hands, and I tell them, they call me manos de Dios, manos de Dios, whatever it is. But I'm no Jesus. Okay. I'm not Jesus. I'm not a miracle worker. You know? Like, I'll do the best I can.
Yeah.
You know? But my game plan is really simple, and I do a lot of consults of people I don't know. And your people are more than welcome to contact me. You can thank God for this nerve rebuilding machine with the neuropathies and these chronic pains, chronic muscle spasms. That machine's amazing, the one I showed you off my phone. And thank God for the stem cell cream. But you have to know who needs it and why they need it. And I don't just sell things just to sell it. You tell me, what have you tried? What have you done? It's very common that I'm the guy that fixes things most people can't. A, I've been doing it 29 years. B, I like to investigate things and know why something did or didn't work. And then C, it's because I know it didn't work for you. So it's not that I'm so great. It's that if you told me I did this, this, and this, and all right, how did the doctor do it? And what'd you do? And what was your regimen? And what was the quality of that? And I can kind of figure it out, you know? So I would say, like, anybody here, if you have something that nobody's helping with. So getting back to the point is, if I work on somebody, I tell patients, if I work on you 4 or 5 times and you're not 50% better, either I'm not helping you, either I suck, or this is not going to work from you, and we're going to have to do something else. So not that it's going to, like you're saying, you have a lifetime of issues, 70 years, 60 years. But we should, once the body gets what it needs, and I know this from when I had cancer, it sucks it up like a sponge. When your body gets what it needs, like things take time. They do take time. But when the body gets what it needs, it responds very quickly. Very, very quickly. And then it will get incremental. And then it'll incrementally get better.
It's designed to do that, right? If you give it the right ingredients, then it's gonna do miraculous things. As a final takeaway for people watching, listening, what simple steps can people take today to better integrate chiropractic principles and foundational nutrition into their wellness journey? What would you recommend?
I would say, I'm 52. The must-haves for me is definitely good digestive health, for sure. I have a friend of mine. His dad is 92. He looks absolutely phenomenal. I've known the guy for 40 years. He always walked around with a little pill case of vitamins, and he always took digestive enzymes when he ate. Again, there's different grades and levels to it. Doesn't mean if it's more expensive, it's better. Doesn't always work like that. That's why what you're talking about, the way you guys are doing the chelation process and helping it assimilate to the cells, sounds amazing. I would say I would definitely do some type of cleanse a couple of times a year. Infrared saunas are good. Sweating are good. Definitely some cardio 2 or 3 times a week, or walking. I like to get my heart rate up to like 150. Getting adjusted a few times a year definitely helps. Go to a really good chiropractor. I do take before and after x-rays and before and after postural images, so a patient can ever say, you didn't fix me. I mean, you come in and you look like this, and then after like 5 treatments, you look like that. I'm sorry. Good luck trying to sue me.
Yeah.
Okay. You know, that's not the reason why I do it, but I like to make objective changes. But I would say good digestive health is important, good enzymes. I love the minerals. Everybody's mineral deficient for sure. Our food is robbed of nutrients.
Mm-hmm.
People go to the grocery stores and they go in the rat maze. You should stay on the perimeter of the supermarket. That's where your meats, fish, vegetables, and your live food is. In the rat maze, middle aisles, those things have a very long shelf life because they're dead. You eat dead food, you become dead. So when you shop, stay in the perimeter, get your ass moving, get some adjustments, get some minerals in you, get some good digestive health, look into infrared saunas.
There you go. That's fantastic. Yeah, that's amazing recommendations. I really appreciate that. And I really appreciate your time today. I really appreciate your openness to tell us your story, tell us more about who you are, what you do, and your openness to be interested in Truehope and the products that we do. And you've asked some amazing questions about that as well. So thank you so much for that. Can you let people know where they can contact you or where they can learn more about you and your work?
Yeah, real easy. So it's myoneural.us. I should have had myoneural.com, but I waited a week too long and somebody took it.
There you go. You snooze, you lose.
Really Miami, you can figure out how to spell that. myoneural.us. You need anything, you can find me there. And that's it. And if you have any, hey, you think this will work for me, that will work for me. I just had a meeting an hour ago with somebody. He has an international softball organization. And he's like, can you make yourself available to them? I go, yeah. A lot of times people contact me and I say, I think this will work, this will work, this will work. I mean, I have 29 years of experience and I don't BS anybody.
Well, I'm sure a lot of your patients really appreciate that because, who's got the time to be BS these days?
I
don't either. Well, Dotto, thank you so much again for coming on the show. I really appreciate your time today. Thank you so much.
Thank you.
Awesome. Well, that is it for this episode of Truehope Cast, the official podcast of Truehope Canada. I will leave all the information you need to get in contact with Dr. Edward in the show notes, his website there, and I'm going to put a couple other links in there to some of the things he's recommended and mentioned, so you can learn more about that. You can leave us a review on iTunes if you want, a star review on Spotify. But that's it. We'll see you next week.